Governments across Canada and around the world may be loosening COVID-19 restrictions or dropping them altogether, but many countries are seeing another surge in case numbers, and that has public health experts concerned. John Northcott with us as we take a look at these numbers. John, now past 2 years of the pandemic, lots of concern about the subvariant, John.
Yeah, the BA2, very much a reminder that the pandemic is not over yet. This, though, is in many parts of the world, health restrictions are being lifted. So we're watching a number of parts of the world very carefully. The World Health Organization referencing it as the tip of the iceberg. We're going to focus in on the most dramatic numbers that we are seeing in all of this, and that is in South Korea. 621,000 cases in a single day. Compare that to Canada's population, 38 million compared to their 52 million, 5,000 cases a day. So 400,000 to 7-day average in South Korea, watching that very carefully. China as well, a number of hotspots, relatively low numbers according to the official numbers that are being produced by officials there. But we look at a couple of areas in China. Jilin, an area in the northeast, it borders North Korea as well as Russia. We're looking at an effective lockdown of 24 million people in that region of China. Also, Shenzhen in the southeast part of the country. That borders Hong Kong. Hong Kong really having some troubles there in terms of the number of cases. Of course, it is a very densely populated area, and they're having to build a special center there in what would normally be a cruise line port, that in the Kowloon Bay area in Hong Kong. We're talking about reports of hundreds of coffins being brought into the country, or into the region, I should say the territory, hitting the elderly in many cases there. So that's the situation that we're watching for in the east. We should say, though, Japan is lifting some of its health restrictions, although they are still getting upwards of 50,000 cases a day, half of what it was on the peak. Let's look at some other areas in terms of Africa. Some real concerns there. The WHO talking about the lack of vaccination rates. And when we look at some of those numbers, they are dramatic. Only 30% fully vaccinated in South Africa. Libya, 16%. Algeria, 13%. South Sudan, only 4%. South Sudan, of course, still dealing with the aftermaths of a horrific civil war there. But there's also misinformation. And this is something that WHO points to as a real concern in this. And finally, Europe. We're seeing a number of cases increase in areas such as Germany, Austria. UK, though, set to lift the last of its restrictions, and in fact, even areas that are being hit hard are in fact lifting restrictions. Again, a concern to the WHO. Also a lack of testing being seen in many of these locations. That, again, prompting that term, tip of the iceberg, being used by the WHO.
Tip of the iceberg, that's a saying, and I keep hearing in my mind a lot of officials have said we may be done with COVID, but COVID isn't done with us. And you're talking about exactly evidence to prove that, John. What could it mean for us here?
Well, in North America, it has, as we've seen throughout COVID, followed the waves that have followed in the rest of the world. I can tell you that Dr. Anthony Fauci, south of the border, saying extremely interested in his words as to what else is happening in the rest of the world. Canada, of course, we're seeing public restrictions being lifted in so many areas. Those travel restrictions, at least as far as testing, due to come off. CBC reporting many provinces lifting those. Ontario on Monday due to lift many of its restrictions there. Worth noting, though, a bit of news, and this may give some extra thought to the situation. The science table today at noon in Ontario due to release its projections. Now, it doesn't have the same level of reporting to work with as it once did, but using wastewater and some other data, they hope to be able to get a sense of where Ontario at least is headed as we move forward. But what we're seeing is not the same level of hospitalizations, not the same level of death, but we are seeing a consistent level of cases. We'll get some more details on that today at noon. Heather?
At noon, John. Thank you very much.
Okay.